This is Dr. John Jones. I'm the Chief Medical Officer for Concord Medical Group. Today we're doing a customer service training, and that's the topic of our discussion. Customer service certainly has become more prevalent and more important in the healthcare industry, and we would like to talk about that today. For the purposes of CME, I have nothing to disclose. I am an employee of Concord Medical Group and do serve as the Chief Medical Officer, but I have no disclosures to make today related to the continuing education hours to be provided. We will touch on several aspects of customer service in the healthcare arena, and the presentation, while it has many general principles, is really geared toward an audience of providers working for Concord Medical Group. I want to start with a brief story, and then we'll launch into the continuing education aspect of customer service. In 1990, I completed my undergraduate degree in biology. I promptly entered medical school that fall. The school I attended was pretty forward-thinking. They had a class early on for first-year students where we would interview patients and take a basic history and physical on these mock patients. After the exercise, the patients would give us feedback on the interaction. And the written feedback I received from one of these patients has stuck with me forever. In fact, I still have it, and I'm going to read it to you today. She said, "You did a pretty good job, but remember to use words I will understand. Talk to me like I'm a person. Look me in the eye so that I know I matter to you. I am more than the information that I'm giving you. I'm the person to whom that information pertains. There is more to me than the story you are trying to pull out of me. Ask me a question, let me answer, and don't cut me off. I will tell you what is wrong if you just give me time and listen. The way you treat me while figuring out what is wrong with me is just as important as you getting it right and making me better." I'll say that made an impression on me at the time, and it continues to influence my interaction with patients today. Over time, the business of healthcare has evolved from a patient having little say in their treatment plan, where they just do what the doctor says and just accept how they are treated by the clinician who's addressing their problem on that particular visit. It's evolved to a point now where patients have a lot of say, and they want to be involved, and they're considered more than just patients, but also customers who have choices in where they will spend their already limited healthcare dollars. Many of those dollars are now being allocated based not only on the quality of care we provide, but also based on the patient's perception of that care. It is not enough to be clinically astute, but we must be nice at the same time. We must still be clinically competent while also being courteous, kind, and compassionate. As we look at the objectives for this presentation, first, we hope to describe the importance of customer service in the healthcare setting. We hope to discuss ways to improve patient satisfaction, and we want to provide tools to assist the healthcare provider in improving the patient experience. Patient satisfaction is an essential and widely used indicator for assessing healthcare quality. Patients will receive a survey asking for their assessment of your work and that of the healthcare team. This measure is sometimes referred to as patient satisfaction, patient experience, patient engagement, or customer service. Regardless of the name, it is based on the patient's perception of the care provided by the team on a given occasion. Why is this important? Good customer service improves patient engagement in their treatment plan. Good patient experience improves patient compliance. It improves outcomes, improves the image of the provider and the hospital, and it also reduces liability in lawsuits. This is where our presentation turns to a decidedly Concord focus. We've opted to present this information in a way that represents Concord Medical Group and the team approach to medicine. We've labeled this CMG Teams. The C stands for committing to courtesy, kindness, and compassion. I'll grant you kindness doesn't start with a C, but we're going to include it here at this point. M, maintain integrity and make an impression. G, greet the patient and the family and do so genuinely. As we move on to the teams aspect, T stands for take a seat. Take time. A tender touch is important, and it's also about teamwork. E, we want you to be engaged. We want you to examine the patient. We want you to encourage the patient to explain and to elevate the other members of the team. A stands for accelerate care. M, manage expectations. And then S, send them on satisfied. We'll go through each of these in detail as we move through the slides. As we look at C, commit to courtesy, compassion, and kindness. I'm going to give you a statement here, which was found in the book Change the Culture, Change the Game. It's written by Roger Connors and Tom Smith. The statement says, too often leaders attempt to change the way people act without changing the way they think. As a result, they get compliance, but not commitment, involvement, but not investment, and progress, but not lasting performance. What we're after is commitment, not just compliance. There's a difference between the two. Commitment begins when we have a team who believes in what we do. As we think of commitment, I want to think of words that are synonymous with it. Those words are dedication, devotion, guarantee, a pledge, a promise, taking responsibility, and a vow. I'm asking you to commit to extend courtesy and compassion while being kind to every patient, no matter how difficult they may seem at the time. When you're committed, you're dedicating and devoting yourself to the process. You're promising to do all you can to make it work. You're pledging to overcome obstacles, and you're taking responsibility for the outcome. Your level of commitment should be communicated to others. It should be clearly seen by the patients, their families, and the team with which we are working. The messaging from the team must be consistent as well. As we move on to M, maintain integrity and make an impression. Integrity is doing the right thing even when no one is watching. It means being honest and having strong moral principles. A person with integrity behaves ethically and does the right thing every time, even behind closed doors. Integrity is a character trait that reflects a person's degree of honesty, adherence to moral principles, and a complete harmony of one's thought, speech, and action. People who demonstrate integrity will draw others to themselves because they are trustworthy and dependable. You must be consistent. Yes, we all have a bad day and are influenced by our surroundings. And we must be careful not to allow our environment to cause us to sway from our commitment and the collective mission. The other part of M represents making an impression. We want to present ourselves appropriately, to be open and confident, be aware of our body language, and always be courteous and attentive. Smile and make eye contact. You get one chance at a first impression. Make it count. Introduce yourself. Smile and act interested. Yeah, maybe it's February, and yeah, you're not feeling well yourself, and it's the 12th case of flu you've seen in the last 6 hours, but it's the first time you've seen this patient for the flu today. Make sure to make a good impression on them. G, greet the patient. Don't only greet the patient, but greet the family and friends who are with them on this particular visit. Greet them warmly and genuinely. Acknowledge all the others in the room. Introduce yourself. As an example, I'm Dr. Jones, and I get the pleasure of taking care of you today. What brings you in? Be pleasant, be professional, and be personable. Everyone in the room is important, the patient being the most important, but everyone is there for one reason or another. Be pleasant and personable to them all. Greet them all, then turn your focus to the patient. In the case where the patient can't speak for themselves, identify the one person in the crowd from whom you can get the most reliable story and communicate directly with them. Convey to the family and the patient that you're glad they are there and you are here to help. And with the letter T, we say take a seat. Take time to talk. A tender touch is important. And remember that teamwork is important as well. Take a seat. The concept of committing to sit or commit to sit is important. Sitting at the bedside conveys to the patient that you spent more time with them than you actually did compared to providers who stand at the bedside. Committing to sit is an important part of customer service. So take a seat. Talk, don't interrogate, and use common language that the patient understands. Also, touch is important. We'll touch more on that as we get to E on the examination, but touch is important. A hand on the shoulder, appropriately placed, represents an appropriate caring light touch on the shoulder allows you to connect with the patient and shows you're here to care for them. And then remember, T also stands for team. We need to manage the team up. We need to speak well of our other team members and acknowledge them as we take care of the patient. The letter E stands for engage, examine, encourage, explain, and elevate. We don't be engaging in our conversation. Get the patient talking. It will develop rapport and will also give you further insight into their complaint. When they feel comfortable talking with you, they will tell you more than they would otherwise. We want you to examine the patient also. Examine them physically. There's more to the examination than just inspection. The examination also includes auscultation, palpation, and percussion. The physical exam is something that we've really fallen away from in recent times and is still very important to conveying to the patient how important they are, but also getting good clinical information as we examine the patient. Also, during our interactions, we should be encouraging the patients. Abraham Verghese posed the question, in an emergency, what treatment is given by ear? He answered his own question with this, words of comfort. We also need to explain to our patients the process of this particular visit. We need to explain the tests that are to be ordered. We should also set expectations as to time and how long the test may take, and also any associated pain and or noise expectations for those tests. The patient should have a good understanding of the expectations on that visit after your initial interaction with the patient. We want to talk up our partners in care. That includes other departments, nurses, techs, environmental services, nutritional services, everyone who have an interaction with the patient. We should be constantly elevating the team as a whole. For the letter A, we've used the term accelerate care. We want to initiate care immediately and get the ball rolling on diagnostic studies. Protocols are great for this, but as a provider, you want to get up and see the patient as soon as possible. Yes, other priorities will be present at times, but as soon as you have the chance, we want you to initiate care. It makes the patient feel important and it improves throughput. You'll need that bed again, so accelerate the process of clearing it out for the next patient. Remember that wait times and delays in care are some of the most common reasons for patient complaints. We should check in frequently to give updates, reasons for delays, and to see if the patient needs anything. Make sure they get that blanket they asked for, even if you have to get it and take it to them yourself. We always want to follow up on results and reasons if we've not received those results in a timely manner and communicate those delays to patients. Always undersell, but over-deliver. For M, we say manage expectations. We want to reiterate the care plan and be responsive. Always want to make a second appearance before they leave. Also make rounds on long-stay patients to check on and update them. Frequent pop-ins to give patients updates are really important, and it conveys to them that you care about them and that they are still important to you, even though there are other patients in your care at that particular time. Always make a second visit to see the patient. You made your initial assessment, you've ordered tests, and those tests have come back and resulted. You should always follow up with the patient prior to them being discharged from the department. You want to convey the test results to them. You want to convey the importance of those results. You want to convey the importance of follow-up as well and the needed treatment plan. You want to answer every question they have and give them the opportunity to ask questions and have them all answered prior to leaving the department. You should also thank them for coming and seeing you today and selecting your facility for their healthcare needs on that particular day. For the letter S, we want to send them away satisfied. Sum up the care that you provided, the needed services for follow-up, and the treatment plan, and again thank them for seeking care at your facility on this occasion. Invite them to return if their symptoms don't improve or if they have other healthcare needs in the future. As we conclude our time in this discussion of customer service or patient satisfaction, I just want to remind you of the CMG team's approach. Remember to commit to courtesy, compassion, and kindness. Maintain integrity and make a great impression. G, greet the patient and be genuinely friendly with them and their family and anyone who accompanies them to their visit. Take a seat, take your time. Remember that a tender touch, appropriately timed and placed, is important. Also convey the importance of teamwork. Be engaged, examine the patient, encourage the patient. Always explain to the patient the process of care and elevate the team around you. Accelerate care. Get in and see that patient in a timely fashion and initiate their care appropriately. We want to manage expectations and always send them home satisfied. I appreciate your time and engagement in this customer service talk. I realize that it may prompt questions, and if you have questions, please feel free to contact me through my email address at Concord Medical Group. Thank you for all you do for Concord. Thank you for your time in viewing this. Remember to always put the patient first. It will always be successful. Thanks and have a great day.